So, which would be the best hormone replacement therapy regimen? Actually, it has to be adapted to your own condition, depending on your hormone levels, whether you're premenopausal or menopausal, things could change. But there's one thing which is really important, and it is also the nature of the hormones you're taking. So a lot of people are talking about bioidentical hormone, and there's a lot of confusion about it. First of all, bioidentical hormones are not natural hormones. Obviously, you cannot take the hormones in another female body and actually transplant them into you. So they have to be produced artificially in a facility that does some chemical modification of some other compounds to produce hormones. But when we're talking about bioidentical hormone, we're talking about hormones that do have the same chemical structure as the hormones that are produced naturally in your body. And that is significant. Why? Because progesterone has more protective effects than all the progestins. And so let's have a look at why is that so and why the chemical structure does have some importance. Let's look at the picture here. You see the naturally occurring estradiol, that's the chemical structure, which is the female hormone. And then just below you see the testosterone, which is the male hormone. And the one which is the lowest actually is progesterone, and we'll talk about it a bit later on. You see, estradiol and testosterone are almost similar, but some very slight modification in the chemical structure. And that slight modification is enough to produce vast physiological change. So that if you give testosterone to a woman in a sufficient quantity, she will look like a male. Okay, so let's have a look now at progesterone and progestin. So progesterone is that chemical structure that you see here. And one of the progestin, which was the most commercially used in the last 10 years, which was called Provera of medroxyprogesterone, has a chemical structure which is vastly different. You see all in black, the addition to the naturally occurring hormone to make it patentable so that somebody could have a legal right on that otherwise naturally occurring progesterone. So obviously, if a very slight difference in the chemical structure as the one occurring between testosterone and estradiol could have vast physiological effects, a modification of the chemical structure of the progesterone could also have it. Actually, it is quite significant. There was a European study, an extensive one, that studied more than 80,000 women and segment these women according to the hormone replacement therapy regimen they were taking. And it did compare the occurrence of breast cancer, depending whether women were taking estrogen alone, estrogen plus progesterone, or estrogen plus progestin. In all women taking estrogen plus progestin, the relative risk of breast cancer was increased. In women that were taking estrogen plus progesterone, the relative risk was not increased. In women taking estrogen alone, the risk of breast cancer was slightly increased also. So it tells us that if you need to take hormone replacement therapy, you need to take the bioidentical progesterone, which still could be done by a pharmaceutical company as long as it is a progesterone. And that also means that even if you don't have a uterus because your matrix was removed by surgery, you still need progesterone to decrease your risk of breast cancer. So it is a bit fallacious to say that because you don't have your uterus or your matrix, you don't need progesterone. You do need it. So that's the most important thing regarding progesterone. The other thing is, if you need to take estrogen, you should take estradiol mostly, and that estrogen should be given transdermally. Why? Because transdermal estrogen has less impact on the blood clotting mechanism and does not increase significantly the risk of thrombovenous embolism or making blood clots in your veins, and does not increase the risk of stroke. So, contrary to oral, actually, estrogen, which does increase it. So there is a significant difference here. And moreover, we know that when you add progesterone to estrogen, you do also decrease a bit further your risk of thrombovenous embolism or blood clots in the organism.